Tēnā koutou katoa and welcome to LBC Online Patient Forum webinar series. My name is Kate McCarty and I'm a Support Services Coordinator here in the Garden City. Today we are grateful to have guest speaker Wendy Jar here to present her talk titled Self-Empowerment from Hospital to Home and Community Care. There'll be plenty of time for questions at the end, so pop them in the Q&A box down below. Wendy Jar has worked in haematology for over 20 years and is the clinical nurse specialist in the haematology department at Christchurch Hospital. Throughout her career, she's gained extensive experience supporting patients through complex treatment pathways and navigating the emotional and practical challenges of living with blood disorders. Wendy is passionate about empowering patients to take an active role in their care, ensuring they feel informed, supported, and confident in making decisions about their treatment. She believes that patients should never feel like bystanders in their own healthcare journey and is committed to fostering open communication and shared decision-making between patients and clinicians. In her current role, Wendy works closely with the multidisciplinary teams to deliver high-quality, patient-centred care. Her dedication to advocacy and support continues to make a meaningful difference to the lives of those she cares for. Thank you, Wendy, for coming today.
Lovely, thanks Kate, and welcome everybody to this webinar. Please forgive me if I'm a little nervous. This is the first time I've presented in this forum, and yeah, and we'll just see how things go. Now I have a presentation that I'll discuss with everybody, and then I will be there'll be plenty of time, like Kate said, at the end for questions. So hopefully you can see my screen now. It tells me that you can. So we're going to be looking at self-empowerment, and I really tweaked the title a little bit and looking about life after that cancer diagnosis and what sort of happens. So to start off with, I just wanted to recap. Sorry, I just need to... Here we go. I just wanted to recap what happens, because for most people, you know, they're going on in their lives, they're on a certain track or destination, that the trajectory that they're traveling on. They've got lots of life pressures, there's family commitments, you know, career and opportunity and job opportunities that come along. There's potentially lots of social things that are happening in your lives. For most people, they know what their role in life is, you know, whether they are a mother or a father or a brother or a sister. They know, and they're pretty confident of where they sit in life's plan. People still could be unhappy or happy with where they are, but they have a bit of a trajectory. Then along comes this blooming cancer diagnosis, and all of a sudden the life plan that you sort of had in front of you is now taking a bit of a different turn. And for a lot of you, it's completely unexpected, and you are in this position of what to do, and you're told what needs to happen, and it can be quite a scary prospect. So then you come along and you have treatment. So for lots of people, treatment is reasonably straightforward in the end, even though it's quite scary and very stressful at the beginning. Once you get into the pattern, it is reasonably okay for most people, but for some people it's quite messy and all over the place, and there might be lots of hospital admissions to and from outpatients for care and management for different things, and also in and out of the day wards for treatments. You know, there might be no adverse effects from treatment, and there might be some that are quite manageable, and there's some that can affect people's quality of life. But at the end of all that, you do finish your treatment. And now the big question is what's next? And this is really what this presentation is about. What happens after treatment? You know, there are some people with blood cancers that are on treatment lifelong. There's some people that have blood cancers that with a curative intent. So the aim is that, you know, we've cured their disease and we may or may not see them again. And there's some people that we know that their blood cancer will come back at some point, but we're just not sure when that will be. So the feelings that people have are very varied. You know, life is a bit of a crossroads again. So you had a bit of a crossroads, you know, with your diagnosis and needing to have treatment. And now things are, you know, now you've finished treatment, and that is a cause for celebration. But also what happens in my experience is that, you know, people are really relieved that they're finished and they're quite hopeful for the future. But it also brings up a lot of anxiety, because what will happen now? What if it comes back? What symptoms might I feel? I'm not going to be seen by hematology quite so much, so there is an anxiety component. People generally are quite fatigued after treatment. There might be some toxicities. A key one is, you know, peripheral neuropathy, so the numbness and tingling that you might have in your fingers and toes. You know, sometimes that stays there forever. Treatment might have caused financial stress, because you might have needed to be in and out of hospital, and you may not have been able to work so much. And then you've got worries with your family and friends and socializing again, because during this cancer treatment, you might have um, maybe not have socialized quite as much, for the, you know, worried about getting infections and things like this. And then all of a sudden, you don't have to worry about those things again. So how do you actually reintegrate back into your normal life? And for some people, they've had quite intense hematology oversight, and it's been quite regular. And, you know, we've been quite involved in the ongoing care. So what happens is you go on to an active surveillance program, and, you know, that involves routine checkups, to monitor for disease recurrence or progression. It usually involves a physical examination, vital obs checks, blood tests, assessment of any clinical symptoms, similar or different that you may have had prior to your diagnosis. You may have scans and other investigations depending on what is found. This is also called watch and wait, and some people are on a watch and wait or active surveillance program before they start treatment, because with some blood cancers, there's an ideal timing to start to have treatment, and it may not be at the beginning when they are initially diagnosed. So, what's next? So how do you get your life back on track and in the same trajectory that it was before you started treatment? So recovery from cancer treatment is not linear. You know, like I think I think, and for a lot of people, especially if this is their first time, you know, there's that relief and that celebration that their treatment is now finished, but then there's an expectation that maybe things just keep on improving. And I can tell you now that that's not always the case. There's loads of ups and downs. I think of it like the Rocky Mountains almost. You feel like you're winning on one bit, and then all of a sudden you feel like you're not winning on the other bit. And so it's never a linear, straight up and down, continually improve. You might find that your energy is better, like it's really good, and then you think, oh, I can go off and do all of those things, but then you might pay for it the next day because you've overdone it. There's actually no time frame to recovering from your treatment. And, you know, I'd like to say that, you know, 3 months after treatment, things should starting to be getting back on track. And that's probably realistic for most people. But, you know, it could take longer than that. It can be really frustrating because you feel like you want to be able to go and do these things. You have finished your treatment and you want to just get on and do things again, and maybe you just can't quite get on and do them. There's no handbook for recovery, so there's no step-by-step instructions, and it is very individual. And during this time, you're starting to have less contact with us as well, with the hematology team. And you really are generally left up to your own devices, and you're left to navigate that transition from active treatment to active surveillance. And that can be really tricky for some people because they really don't know where to start. And I think that from my perspective, it needs to be embraced as a positive aspect of your care. This is where you're finished treatment, and we're saying to you now, you're finished treatment, you need to start going off and doing the things that you really want to be going off and doing. Whereas some people find it quite scaring and quite daunting, this transition period. So I feel like I had my first experience with doing this presentation using AI. Actually, I thought, right, I'm just going to put in some things into AI and see what comes up. And really, I think the essence what we're doing is what we're talking about is rehabbing and cancer rehab and how to engage with rehabbing after your diagnosis. And I thought this slide was quite good because sometimes there's an opportunity to actually get quite fit and healthy and well before you start your treatment. And they have the battery system here, which I thought was really great because it shows you that you can charge your battery up and get ready for what's ahead. And there'll be periods of time when your battery's a bit lower, but at some point you'll get to a full battery again. And the aim of rehabbing really is so you can resume your normal daily activities and reintegrate back into your normal life with little problems. And for me, it's quite a holistic approach. So you're looking at, your physical, your psychological, and your social support. So it's just not focusing on one area of your life. It's looking at your physical aspects, your mental health aspects, and then your social aspects as well. And with cancer rehabilitation, you're looking at preventing or reducing that disability that you might have had with the toxicities and the cancer treatment. If you look overseas, cancer rehabilitation is a big business. And I feel like in New Zealand, we're probably just a little bit behind the rest of the world in embracing this. And of course, funding something like this as well. So as I said, I love the battery analogy. And really, I've put this slide up to show you that your battery can be anything along that trajectory. So, you might be in an area where it's fully charged, then at a period of where it's just really low and you need to be plugged in to get recharged. And I think it's unrealistic to expect you to be fully charged and off on the get-go straight after cancer treatment. And most people, they would probably go from the orange, the yellow, and the green off and on through their cancer rehabilitation period. And for some people, especially in that older age group, we may not get the battery full either. And that's a degree of frustration and a degree of acceptance that people have to have. But, life after cancer is not a race. You don't have to get back to doing all those things that you did. You need to pace yourself, pace yourself with what you're doing. And from my experience, this diagnosis changes you. So, it's an opportunity to look at reprioritizing important things in your life and looking at how you might want to do things differently in the future. But really, when we're looking at self-empowerment, part of it is about restoring function. It's about improving your symptoms. It's about looking after your emotional well-being with the aim to improving overall quality of life. So, what to expect from hematology? So we've already covered a little bit of this off, but you'll have regular appointments with us, and that'll be actively monitoring. You'll have the blood tests, looking at patient symptoms, plus or minus scans. There'll be the ongoing monitoring for side effects because, some side effects occur during cancer treatment and some side effects can occur after cancer treatment. And for those of you that have developed toxicities or side effects during treatment, sometimes they take a wee while to improve, and so we want to monitor them. We have a multidisciplinary approach. So we would refer you to the clinical psychologist if we needed to. We would, to look after your mental well-being. We would still have access to the dietitian for nutritional support. And those things are a little harder to get access to in the outpatient areas, but that's something that cancer areas are trying to work on. And the regular appointments also enables timely assessment or reassessment of disease status. So if someone rang in with some symptoms, then we might need to see them a bit earlier to see if it's related to their cancer diagnosis. In Christchurch particularly, and I'm sure throughout the country, but I am not exactly 100% where, some of you will start seeing nurses in nurse-led clinics as opposed to seeing your haematologist. And please take that as a positive part in your journey, because that means that you're well enough not to see the consultant, and they have confidence in often a clinical nurse specialist that they can manage your day-to-day or month-to-month needs. And at some point, you'll be discharged to your GP, and that's very variable. I would suggest that for most people, it's consultant driven as to when they might discharge you. So often we would see people after treatment every 3 months just to keep an eye on things, and then we would push that out to 6 monthly, and some people might do that for a year and then discharge after that. Some people might keep patients for a year. So there is no hard and fast rule, particularly in Christchurch at this point in time. And I do think that in the future it will be driven by patient numbers, because we have limited resources, and so we would need to discharge people maybe after a couple of years of treatment, so the workload can be managed for the medical team. But if you need to stay with us, the medical team will not discharge you until they are happy with you. Just going back to being discharged back, I've got some slides about the GP, but being discharged back to your GP, the GP has ready access to the haematology services. So, even if you are discharged and you see your GP about some symptoms that you're now experiencing, it's very easy for them to do a referral back into haematology. So you're not just left back out there by yourself. And we'll find it hard to get back in. It's generally a pretty easy or seamless process to get people seen or re-seen if they need to be seen. So as part of your treatment, you would have got an immunosuppression card, and I've just got this one off the internet, so it's nobody's specific card. And that card's really important for when you are having treatment. And that's because if you become unwell during treatment, it's you have a number to call, a triage number where people can assess you over the phone and say, well, we need to see you, or you need to go to the emergency department, or actually you don't need to see us at all, that's a GP issue. There comes a time when this can stop being used. They're not lifelong cards, as some people think that they are, and they have a limited use around that episode of cancer treatment. Now, there's some people that will have this card for very indefinitely because of the type of treatment they're on. But generally, if you're having 4 to 6 cycles of treatment, usually a couple of months after your treatment, your immune system should be just about back up and running to its normal, normal person's immune system, and that's the time when the card has less effect. So you could still ring, but often we would say, I had a phone call this morning actually, and the patient's out of treatment for quite a few months, so I've asked them to see their GP. But people do have direct access to the haematology nurses their landline number, and there is always that place that you can talk to the nurses about issues that you might be having, and they can help direct you to the right place. If you've been discharged from us, that's a little more difficult because we need a referral back in. It's just the process of how we see you, and often if you're really unwell, clearly you would present yourself to the emergency department, if you need to. So the role of the GP. So the role of the GP is the first port of call for you in the future to contact any symptoms. And I would suggest that people that have finished treatment, they should actually make an appointment to see their GP, just to have a bit of a catch up with them about where things are and what their needs are. If I'm discharging someone, I usually have a list within a letter with the things that I want the GP to be doing with that patient. And I also send a copy of that letter to the patient so they know what I've asked the GP to do, and how we want them monitored into the future. But they, like I said, they can consult with us if they need to, but they look after your overall health and your other comorbidities that you might have. We're very good at doing the hematology bit, but we're not very good at doing anything else. And so your GP has that knowledge about the diabetes, or they have that knowledge about the heart issues or the blood pressure issues. That's not our area of expertise, and we actually defer to them for their expertise to manage those things. And if you have those type of comorbidities when you come in to start your treatment, we would still expect you to be going to see your GP for your blood pressure medication and your diabetes monitoring. You might have some ongoing treatment side effects that need managing, and they will help us with that if we need to. To be honest, I think they're better at managing pain than what we are, because they see it more often, and they are very expert at managing that. They can provide an education perspective to your consultation, but they also do lots of national screenings and vaccinations and things like that, and they can refer you to other places for support. So I think it's really important that you engage back in with your GP. Having said that, though, I want to acknowledge the difficulty that it is around GP access, and we hear it some days every day, but at least weekly I hear the conversation, or I'm involved in the conversation about I can't see my GP, I don't like my GP, there's only an acute clinic that the GP runs, so I don't see the same GP every time. They're big problems that we can't fix, and we can't see everybody and do everything for everybody. So my best bit of advice is to keep engaging with your GP, get to know your GP. Some people are very happy not to see the same person every time, but they're in the same practice. Some people, it's important that they see the same GP every time, but you need to keep that relationship going, particularly during treatment as well. So they monitor for all of those things. I think I've probably doubled up on this slide, to be fair. So they can refer back to us if they need further advice. They're responsible for that overall picture of your healthcare. And they can also, like if you have issues worried about your heart function and things like that, they can refer you to the cardiologists. If your kidney function isn't so great, they can refer you to the kidney doctors. So they're probably like the hub in a wheel, and they can actually refer people out to all of those different spokes as things are needed. So the things are, though, is that when you should see your GP. So if you've got some new or unexplained symptoms, you should always go and see your GP. If the side effects of your treatment is not improving, then you might want to see your GP. And of course, ideally you want to see your GP not just when you're sick. You want to see them for your general health maintenance, making sure, your vaccinations are up to date and your screening programs, whether it's bowel screening or breast cancer screening or cervical screening, those things are all up to date. Because really this is going to provide better health outcomes overall for you. It's going to provide you with a degree of peace of mind going forward, and it's also an opportunity to personalise the care that you get, so you can get a bit of a roadmap or a passport about your health plan going forward. So I just wanted to recap on the, when I talk about the side effects of treatment, these are the types of things that I'm talking about. So fatigue, like I said, can be a big one, or you can have reduced mobility. The biggest thing is, especially when people are a bit older, they can easily lose muscle mass, and so their ability, like to get up out of a chair, or if they fall over, get up off the floor, or open or close things, is reduced. Poor nutrition or inability to eat well, or have enough fluid because of taste changes or mouth changes, can impact how you recover. Some people can have ongoing pain and joint pain or muscle aches, and some people get a bit of muscle pain when they are starting to rehab as well, because they haven't used those muscles before and they get a bit worried. And some people's pain might be more of an arthritic pain as opposed to a cancer pain. So it's really hard not to jump to the conclusion that this could be the cancer. So we talked about the numbness and tingling that people can get. For some people, they can have an increased risk of osteoporosis, so that's thinning of the bones, and that can lead to fractures. Some people can have some heart issues after chemotherapy. That's often a long-term effect, but clearly, if you had heart palpitations or increased shortness of breath, or general concerns about your heart's functioning, that would be a good thing to go and see your doctor about. Some people have ongoing gut issues, so nausea, constipation, diarrhea. Your skin can change with treatment, and you can get dry skin and rashes quite often, and it can become more sensitive to the sun as well, so you can actually sunburn easier. And also you can get some hormonal imbalances, particularly if you're younger, and it can upset fertility, as can the treatment itself. So they're the sort of physical things to look out for. And then, there are quite a few emotional and psychological impacts. So, people experience anxiety and depression, the fear of the disease recurring. And for some people, they can actually get post-traumatic stress. This is probably on the less common side, but for some people, where if you think about that, I think maybe the second or maybe the third slide in, where the train tracks were everywhere. If treatment's been really messy and they have had an ICU admission, and things, one thing after the other's gone wrong, it can be quite traumatic. People have ongoing memory and cognitive changes. So, we talk about chemo brain often, but that can actually last for quite a wee while. So your ability to concentrate or think about something is reduced. And when you're reading a book, you might forget what the story is about, or you're trying to follow something on the telly and you can't quite remember you lose your train of thought, I suppose is what I'm going to say. And you can change how you view yourself, because for a lot of people, they've had some hair loss, they might have had some weight changes, and so the person that they look like in the mirror at the beginning of treatment is not the same person when you look like in the mirror at the end of treatment, and that can be quite distressing for people as well. And if your emotional well-being is a little fractured, that can lead to some of those physical things as well. So anxiety and stress doesn't help with nausea and things like that. So there's also these challenges going back. So you're looking at your sometimes there are some physical limitations on actually what you can do when you go back. You might have to go back to work part-time, and returning to work can be quite challenging for some people. Some people have managed to work through their treatment, and so it's not such a big issue. But for some people, they've had to stop work for a period of time, and then there's a thought of coming back. So, when do they go back? When do you start going back to work? Do you go back, a graduated return to work? Is that possible in the job that you're doing? Have I actually managed to keep my job? Because some people, they lose their jobs during treatment because they're not there. And it's also the same in your social circle. So I have found for a lot of people, they they might stop socializing because of that risk of infection, or the people that they thought would be supportive of them aren't, and other people that they don't know as well are more supportive. And so that social dynamic can change as well. And so you have to re-navigate that social socializing again, and not being scared of going out and worried about catching something. When do you wear a mask or not wear a mask? So it can be all quite challenging. And like I said earlier, there is actually no textbook for this. So as Kate said in my introduction, I'm full on for self-responsibility. You need to invest in your healthcare. You need to be proactive in identifying and managing the issues. You need to take control of things. You need to set small goals first when you're recovering, and then you might have a larger goal that you want to achieve in 6 months, but what are your day-to-day goals? What am I going to do today? So, okay, my fatigue's really bad. Today I might go and walk 2 lampposts today outside my house, or if you've got a long drive, I might walk up and down the drive 3 times. So set yourself little goals. Don't overdo things, because I feel like people get a rush of energy, and then they go and do all of these things, and then they spend the next 5 days on the sofa because they're absolutely exhausted. So you just need to set small goals, not overdoing it. Take control of the situation. Don't allow people to do things to you. Understand what you need to do to make your recovery successful. Take one day at a time. Each day is not going to be the same, and don't expect because you've done this one day that the next day you're going to be able to do exactly the same thing. Seek help when you need it. There are, via your GP, or if you're still within our services, there's nothing wrong with ringing up and asking a question about something. And no questions are stupid questions. If you need help, don't be afraid to ask or feel embarrassed that you've got to ask this question. And self-examination. If you've had enlarged nodes and that's the reason why we were treating you for lymphoma, say, then get into the routine of checking under your arms, around your neck, in your groin, and making sure that you can't feel anything, and just do some of that healthcare and health maintenance. So this is what you should be doing, to in your recovery. You should be physical. So there's so much information out there about physical activity before you start treatment, during your treatment, and after your treatment. Now, being physical will help you. It will help the fatigue, and it will help sleeping. And it usually will help your appetite as well. So, and being physical, like I said, could be just short walks. It could be engaging in a physiotherapist. It could be going back to the gym. But you really do need to get up and start doing something. It's good for your bone health, and having a little bit of resistance training. You need to eat well. So you need to try and eat healthily. Small and often, if you can't bear the big 3 meals a day, snack throughout the day. And having loaded smoothies is really good to help keep your weight on. You're allowed to rest and sleep, so don't feel like, God, I can't have a rest today. Actually, you can have a rest today if you're in a situation that allows you to be able to do that. And you need to you need to come up with a plan to be able to, you know, reintegrate back into work, or you know, start dipping your toe into socializing, and seeing friends and family again, just like you were doing beforehand. There are things that you can control and that you need to be proactive on. So, you know, you need to set goals for yourself. Set those small goals, might be around, you know, your physical activity or getting out and doing stuff, or it might be a longer term goal for, I don't know, walking the Milford track or something like that. You, you know, the whole idea of having treatment is for you to enjoy your life and have a good quality of life. And so you need to think about how you're going to do that. What are your priorities? How are you? What do you want to do? Because it is quite confronting a cancer diagnosis, and that you know, you for some people, they're confronting their mortality as well. And so actually at the end of treatment and there is no obvious signs of cancer, this is an opportunity for you to look at your life and prioritize what you want to do. You know, some people, I wouldn't suggest changing things straight away, but some people do transformational changes in their lives as a result of having treatment. And you know, there's a whole lot of stuff out there about being mindful and you know, living in the moment and breathing in the air and understanding, you know, what it is in that moment and not looking too far forward, and just taking a breath for yourself. And I think that's a really good thing to be doing as well. So, you know, there is psychological support and counselling, and I've already talked about, you know, you need to feed all the physical sides of you, but you also need to feed the mental well-being. And there are loads of places out there that provide counselling. You know, there's a leukemia and blood cancer. There you know, groups and coffee mornings. You know, not every area has a clinical psychologist, but you know, some areas and some hematology areas have access to that. You know, that's not an equitable way of looking at things, but that's you know, hopefully in the future that would be different. And there's also some, I'm pretty sure that via GP you can access 3 free counselling sessions as well. So there are some things out there, or some, you know, options for you if you feel that you need some more psychological support. So future directions, I've put this slide in because there is a lot out there at the moment, and I suppose this is where you need to be active and looking. And I know for a lot of patients connected to LBC, you're a very active group that always goes and seeks lots of things out. So I think telehealth in the future is going to be one of those things that you know, that's going to have more and more importance, particularly around equity and people who live more remotely, because, you know, people can't get into the main hospital centres. And so a lot of this, you know, a lot of the follow-up potentially might happen over telehealth in the future. So we might do exactly what we're doing today, Zoom into your house and have a bit of a chat. And also I know that there's a couple of physios in Christchurch that use telehealth for patients that aren't in Christchurch, for physio programs for rehabbing after cancer treatment. And I think that might end up becoming more and more, you know, the direction of travel for more and more multidisciplinary teams. You know, like I said at the beginning, I used Copilot to help me put this up, and I think the reality is that AI, whether we like it or not, is going to be infiltrating our lives at some level, and there will be AI tools in health in the future that may be able to support you. But there's actually lots of exercise apps out there, and I just wanted to put that out there as well. I think if you put in your app store lazy exercise or chair exercise. There's loads of things out there. I see ads all the time coming past my things that I look at. And so they might be a good starting point for people who don't have access to that physio, or don't have, that live more remotely, that want to do a bit more resistance training. And you can do this in your chair. You don't need big weights at home, and you don't need to be strong at home. You can do lots of exercises from your chair. So I think that in the future, that's probably going to be embraced a little bit more in health. So there's always going to be hurdles. And so what you want to do is you want to try and make the hurdles as small as they can be. And so if your head's not in the right space and you have lots of physical symptoms, the hurdles are going to seem like they're really high. But if you start getting us being physically active, acting well, reintegrating back into your life, and having a good mental well-being, then the hurdles become much smaller and much manageable, and they become easier to get over. So as time goes by, the hurdle that you're looking at might be quite large, but if you break it down into your little goals and how you're going to figure out how you're going to get over it, then next time you come up to that problem, that hurdle is not nearly as big as what it was when you first saw it. So I don't know if you remember, but the picture behind is the picture that I had on at the very first. Your life's going along in this direction, and then all of a sudden you get the cancer diagnosis. For a lot of people, their life changes, and the journey is now a new journey, and that's not necessarily a bad thing. It's just a different thing. So I just wanted to point that out. For many people, they don't go back into the same life that they have because this changes you. And it can be a little frustrating because people around you are still the same, but you inside have actually changed. And so this is where I see that there's an opportunity for you to figure out, do I like my job? Are these things good? What are the things I really want to do in my life, and how do I set the goals to go and do them? And I don't want you to be afraid of setting a new direction of travel for yourself, because for some people, they've been through such a big journey that looking at and prioritizing things and changing the way you want to do things is actually a positive overall thing. Some people will slot back into their old lives as if nothing's happened, but there's quite a number of people that won't, that it will be quite a different life that they have. And they might look differently, they may not be able to do the same sort of things, and so there's a degree of an acceptance that people have to have, that their life has changed. And it's almost, I was thinking about it yesterday, and it's a little bit like, I don't know if you know, but Elizabeth Kubler-Ross did the, I think there were like about 5 different periods of grief, and there has to become at the end an acceptance that this is my life, and these are the constraints within my life, or this is my new life, and I really love it. So you need to be prepared that life after cancer may not be exactly the same as what it was before. So this is my last slide. So just really in conclusion, we want to, you need to be rehabbing, you need to have self-empowerment, you need to own how you're going to recover from this journey, to improve your quality of life. It's a collaborative relationship between all your healthcare partners, and I think innovation and technology is going to play a big part of this in the future. So I think I'm on to questions now. So I'll pass back over to Kate.
Oh,
are you there?
Just about had a technical error there.
That's right.
Okay, so firstly, Wendy, thank you so much. But before I go on to formally thanking you, we'll just go through these questions. What is the most important thing to really boost my recovery post-treatment?
Man, that's a big, broad question.
Isn't it just?
It is. I really think that and I'm going to share something personal here. I'm recovering from a I had a hip replacement nearly a year ago. It's taken me nearly a year to recover from that. And I think the biggest thing I've done is actually get off my butt and go and do exercise. And so I'm now swimming and going to the gym twice a week. And that's been the biggest change that has occurred in my life. And I hate the gym, by the way. I call it the stupid gym. But I think physically, if you can get yourself into an area of being a little more physical, so you can manage those, you can walk a bit longer. I think being physically fit, I think I've probably underestimated how much that can impact your overall quality of life. So if there was one thing that I would say to people is to get off the sofa and to get out and to go and do things, even if it's just walking around the park with your family, but actually getting out of the house. It's always good to feel the sun on your face, the fresh air whizzing past if it's a blowy day, but actually just, I suppose, smelling the roses, hearing the birds. I think they're really good uplifting things for your mental health as well.
What is your advice around telling family what to expect? They think once treatment is finished, we're back to normal, and it's hard to communicate otherwise.
Yeah, that's a really tough question because I agree. I think people think that you're finished and then it's actually, and for some people the hard work's only just going to be starting, because for going through treatment they can not have the energy to get out and about and do those things. So you're starting from quite a low base when you finish treatment. Your physical energy, your exhaustion levels can be quite high. So actually, the best thing to tell people is that you might have finished treatment, but you haven't recovered from the cancer or the treatment yet. And it's going to take a good 3 months for people to start making inroads into that, and you probably just have to be firm about what, and I suppose this is where you have to start advocating for yourself and be firm about the things that you can do, because my understanding is a lot of families rely on other family members to help bring up children and babysit and pick up after school and all of those type of things. So you have to put the limit on and say, these are the things that I can do this week, or these are the things I can do for you, but I can't do all of those things you're asking me to do. And they're quite tough questions to do, but you have to be bold to do this, because again, we've got to go back to, you need to start to be able to look after, be part of the family and to be contributing. You need to look after yourself first, and you need to make sure you've got enough time to recover. So it's deciding in yourself what you can provide at this moment. And you can talk about the battery analogy. Say, look, my battery's only half full at the moment. I just can't do that for you. Or, battery's 3/4. So yes, I can pick the kids up from school. So, and they're hard. They're tough things, hard conversations to have, especially with family, when the expectation is maybe that you would be there. But you might just have to say, for the time being, I need to look after myself, and I'm really sorry, and I know that puts you in a difficult situation for this, but I want to be able to help you in the future, and so I just need this bit of time now to recover, and then I'll be able to help you in the future.
If struggling with well-being and feel overwhelmed, how can you tell if you need to have counselling?
So I think that I think that there is a degree of, you could have some psychological struggle early on after. So sorry, I'm just trying to gather my thoughts. So you can have some psychological distress through treatment, and clearly there's plenty of opportunity to talk with people about that. But then when you finish treatment, you don't have those same opportunities to talk. And so I think there's a period that's acceptable for you to have a little bit of psychological distress and anxiety, and particularly in that very first transition phase. But if it's ongoing and you can't seem to break the cycle, and the hurdle is no smaller, they would be the times that I would think, actually, I need to go and talk to someone about that. And the first person to talk to would probably be your GP, and then they could provide advice further down on the next steps. Some people are talkers and some people aren't, and so I suppose it's about, is it, where do you need to get that nourishment from? Is it from the LBC support groups, or is it from trying to get your group of friends together if they're supportive? But I think if you're thinking about the same issues all the time and they're not getting any better, that's the time I think you need to intervene and go and find someone to help you try and sort that out. There are things such as life coaches. Some people find them helpful, some people don't find them helpful. But of course, a lot of this isn't funded. There's Pink and Steel, which look at they have physios throughout New Zealand that can help with your physical rehabilitation. There's a bit of funding attached to them, but not great amount of funding. So again, accessibility can be limited by finances.
Great. I've got a question here around, could you talk about how things change for partners and for families during this transition?
So I think that that during treatment, the relationships can change, and so some people who, particularly in families where the main carer has been is the one that has the diagnosis, and so the other person has to then take up the mantle of trying to maybe work and do the housework and do all the cooking and look after the kids and things like that. So there can be a change in the family dynamics and the family structure, and I suppose that when you finish treatment, excuse me, there's a little bit of an assumption that things will go back the same they were beforehand, and I suppose the biggest thing is having conversations with partners and family about what's going to happen when I finish treatment. How are we going to do this? How are we going to manage this transition together, and maybe having the conversation about okay, well, I'm actually not going to be able to do those things for another few months, so I still need you to do A, B and C. And for some people, they do just assume that things will go back to normal, and things don't often go back to normal, or they take a wee bit of time. So the other thing is that being prepared for things to take a bit of time to find a new balance, because it won't be the same as the old balance. There'll be some things that are definitely different, and that's this. And there is that worry about cancer coming back, and I think when you then become unwell for the first time, after you finish treatment, a lot of people jump to oh god, the cancer's back, but actually we've got to peel that back and just look at the simple things. So it is just preparing yourself for there will be some other health issues that might crop up, but they may be completely unrelated to the cancer diagnosis. So you need to be open and have those conversations with your family, and some of them struggle to transition back as well. And again, there would be counselling for them, particularly if they've had their partner's had quite a major cancer journey that they might need other support for.
My GP never really knows when they should refer me back to you. Can I ask them to do regular blood tests to monitor me?
So great question. So I think that depends on how long out you've had from your cancer diagnosis, to be honest. So, we would recommend 3 monthly for the first year. Then, if everything's looking okay, maybe 6 monthly. And then maybe maybe a year or two of yearly, and then we would eventually stop as well. So I think it's really about how far you're out from your treatment. Have you had any symptoms? Because usually what happens is that sometimes things are picked up in blood tests, but often is your clinical symptoms, so your weight loss or your night sweats or lymph nodes, etc., that will prompt a visit to the GP, and then the GP would do a blood test then. So it's not often that some cancers are found incidentally on blood tests, but majority are often come with someone being unwell or having symptoms. And I look at a blood test as that it's at one point in time. So, you might have a blood test, a yearly blood test, that's absolutely fine. But then 2 weeks later, you might have some symptoms and your blood test can be not so great. So it's really your level of comfort and their level of understanding that you need to come to an arrangement with, and decide, actually, I do want this monitored, and you can request that it's monitored every year or every 6 months or however. And they can like I said, they can refer back into hematology when they need to.
Right. And last question, I can't go back to my job because it was so physical. Is there any help looking for a new job?
In essence, you'd have to go to WINS. I was going to say, in essence, no, not really, which is sad. And I really feel for you being unable to go back. But, we would go back to the government agencies like WINS. I don't know how far out of treatment you are. You might have access to a social worker still, and they would be able to help support you and point you in the right direction of getting some help, or job seeking, or what you need to do to help with that.
Right. Okay, well, thank you, Wendy, so much for coming and sharing your expertise with us today. Your insights into self-empowerment for patients transitioning from hospital care to the community have highlighted just how important it is for individuals to feel confident, informed, and supported through their healthcare journey. Your dedication to ensuring patients are active participants in their own care is truly inspiring, and we're very grateful for your knowledge and the encouragement that you've given us today. So thank you very much.
Thank you. Thanks, everybody. Have a good rest of the day.
Bye.